The next exercise in the progression is the single leg hinge to the wall. This exercise is sometimes used at the beginning of an assessment as a tool looking at hip rotation. It changes the base of support for the patient by going from double to single leg exercise, so it gives it a little bit more of a challenge, especially for your ankle and knee patients who still have some proprioceptive issues. This person should work on proper breathing technique, stabilizing the core before they begin the movement, and as they go through it, making sure that they continue to hold that neutral spine, forward head and eye position. Allow for a good hamstring stretch for about 2 seconds with glute activation on the completion. Okay, so this exercise is really good for ankles, knees, and hip stability. And he's going to do 5.